If you're not already, have you considered therapy? One of the things that people ask me when I mention that I see a therapist is, how do you know that you found the one? Because therapy is a little bit like dating, I guess, in the sense that some people are right for you at a particular time. In dating, that guy that was perfect for you at the time but then suddenly really wanted to settle down and you weren't quite there yet, timing was a little bit off. Or maybe it's the opposite way around. You met someone that was great but you needed to grow a little bit before things could work. Likewise, some people are there for a short time. So girl you really loved but you spent a lot of time going to concerts together, and when you stopped going to a lot of gigs, you realized that you didn't really have much to talk about. I think it's a lot about right time, right context, and also the right person. Starting a counselling relationship is hard. It is scary. It's a whole big unknown, and at the time, it might be one of the most important, or if not the most important, decision that we can make for ourselves and for our loved ones. And oftentimes, when we're deciding to make a change towards seeing someone in therapy, we're not at the top of our games. So taking the time to find a therapist that you can connect with can sometimes take a back seat to just getting stuck in. But finding that person that you really can connect with, you can build trust with, and that approaches therapy in the way that you need and that you're comfortable with, can be really important in a long-lasting therapeutic relationship that is worthwhile and effective. Understand that you might not find that perfect fit on the first time. The same as you don't always find the perfect mechanic or builder or hairdresser in the very first conversation that you have. But that's why you engage someone, find out a little bit more about them and their work, and then decide to continue on from there. You might not be totally comfortable or 100% on board, but a good reasonable amount of kind of that good gut feel is nice. Now, this is just my opinion, so don't let anything I say dissuade you or stop you or someone that you know reaching out and getting help if you need it now. There are so many different support options available, and I will link some of them in the description below, including Lifeline Australia. But if you are in the position, these are some of the things that I considered when I was looking for mine. Firstly, I thought about my life and my story and things that might be a little bit different or people might be biased against. As much as we don't like to admit it, therapists are human too, and unconscious bias does exist. So I wanted to be really careful about what things were in my life that might be a sticking point. So for example, I am Australian born and I've been raised here my whole life. However, my mum is from the Philippines and I look Asian. So ethnicity and culture may be a thing. I identify as a cisgendered female and I lean more towards the feminine side. I am in a heterosexual relationship. However, I do identify with the queer community and a lot of my friends do as well. So someone who was rainbow friendly and had a very open mind and heart was a complete non-negotiable for me. And then I had preferences. So I studied psychology a while back and I had a preference towards someone who had that much or more experience. You might be looking for someone who is of a similar age or even has more lived experience than you, or has other factors kind of in common or different from you depending on what you're looking for. So maybe that might be gender. I personally was looking for a really good vibe of the room. I wasn't looking for something that was too sterile and too clinical, and location was really important for me. I knew that if I was struggling, motivation was going to be really difficult to find, and actually getting up and getting out and going somewhere. So I didn't want something that was too far away, the same as some people don't want their gym to be too far away because the motivation is fleeting. You might have preferences around cultural background for some understanding that only they can have if they have in common with you. It might be mannerisms or philosophical or world views. And of course, there's also therapeutic approach. And you might already know that you're looking for someone who is going to push you to find solutions and implement them between sessions and really do kind of an action-based therapy. Or you might be looking for someone who is more gentle and who is going to listen to you and really hear you and then provide gentle suggestions through sort of prompting and questioning. Or if you know anything at all about the therapeutic landscape, you might be looking for someone who is a specific practitioner of CBT or EMDR or something like that. Importantly, there is also availability and areas of interest. So if you know that an issue that you want to be talking about is related to marriage counselling, and you find a practitioner who is more related to youth work, it's probably not going to be the best fit. Now, I'm sitting here thinking about all of this today because I saw my therapist today, and it was kind of a funny story where I had originally actually found someone that I really liked, but they had a huge waiting list, months and months, and I didn't know when I was going to be able to see them. And at the time I was really struggling, and I really felt like I needed to see someone sooner rather than an unknown number. And so I began seeing someone else. We're going to call her Lauren, and she's been absolutely wonderful. She's been everything that I've needed during this period of my life. Someone that was kind and supportive and helped me see some things that I wasn't seeing very clearly at the time. She's pushed me when I've needed to be pushed. She's let me just cry when I've just cried. And for that moment, for this year, she has been exactly right for me. Recently, though, the original practitioner that I reached out to, her books are opened. We're going to call her Anna. And Anna practices a kind of therapy that I'm looking for to help me progress and really thrive into the future, not just survive. And I know that sounds very cliche, but just bear with me. So I guess where I'm at is thinking about who is the right person for me, what is the right approach for me going forward. And so I wanted to pose the same question to you. Have you thought about what's right for you in a therapeutic landscape, and maybe who is right for you?